When you look at the chart that we drew with a lot of dots on it and a line drawn through it, you may look at that line and think, well, I don't know, that looks a little bit fishy. Those dots are kind of all over the place, and that line doesn't quite seem to represent all of them well. Well, I'd like to point out this is called a scatter chart or scatter plot, which is used in quite a few studies, including healthcare studies. And I have an example here of a study showing that there was some positive correlation between low coronavirus infections and what's called the BCG vaccine. That's the Bacillus Calmette-Guerin vaccine. It's given for tuberculosis, not for COVID. And this study shows that there is some positive correlation that if you've had that vaccine, you're more resistant to coronavirus. When you look at its chart, it's very similar to ours. There's lots of what we call outliers, dots that are far away from the line, but when you plot the line using a logarithm, as we did, this is a Google logarithm, then you can see a general trend. This is not to suggest that every dot on there is well represented by that line, but to say more that the line in general indicates a general relationship between, in our case, lower rates of COVID deaths and happy patients,